Blood in a dog's stool, known as hematochezia, can result from various causes. If you observe this issue, consult a veterinarian for accurate diagnosis and treatment. Common causes include dietary problems, gastrointestinal infections, inflammatory bowel disease, IBD, colitis, anal gland issues, trauma or foreign objects, intestinal growths, constipation, hemorrhagic gastroenteritis, HGE, coagulation disorders, and medication side effects. Take these steps. Contact a veterinarian promptly. Observe and describe the blood's color, consistency, and amount. Monitor for additional symptoms like vomiting, diarrhea, lethargy, appetite loss, or behavioral changes. Ensure your dog stays hydrated with clean water. Stick to the regular diet and avoid introducing new foods. Remember, only a veterinarian can diagnose the cause and recommend appropriate treatment. Quick action will help your dog receive the necessary care for recovery.